how to use an AED. So a couple of things. An AED is used for when there's a situation that involves sudden cardiac arrest with athletes. It's an emergency tool because sudden cardiac arrest is basically electrical arrhythmia of the heart. So anything with abnormal like beats or a rhythm, no rhythm, we would use the AED for. Sudden cardiac arrest happens with no symptoms sometimes, so it's a silent killer. For example, hypertrophic cardiomyopathy is going to be an enlargement of the heart, and it's a precursor to sudden cardiac arrest. So some signs that tell you that you need an AED are that the person or the patient collapsed. You're going to check the scene for safety, and then you're going to check the consciousness, like if they're conscious. You do that by tapping, saying their name, asking if they're okay. If not, then we're going to ask a second person to call 911, and while they're doing that, we're going to tilt their head forward, make sure their airway is open, and we're going to check if they're breathing. So look, listen, and feel. If there's no pulse, then that's when we're going to start CPR, 30 compressions, 2 rescue breaths, and while that second person is going to get the AED, we continue. Actually, before we do the compressions, we're going to open the chest area up so that we won't be interrupted when the AED comes. So now the AED has arrived. We're going to continue the chest compressions until the second person has opened up the AED bag and is ready to apply it to the patient. So we're going to turn on the AED. The AED will tell you what to do, so you just follow.
Open packet and apply pad onto patient's bare skin.
Some important things to note are that the patient should not have a pacemaker.
Onto patient's bare skin.
So the patient should not have a pacemaker because the pacemaker is already trying to fix the problem. The patient should be completely dry. No metal should be where you're going to place the pads, and your patient should be over 2 years of age. So we're just going to place the pads where they're supposed to be, one on the upper right and one on the lower left. And then we're going to listen to...
Remove clothing from the patient's chest.
So it's saying to remove the clothing. We did that.
Open packet and apply pad onto patient's bare skin.
Open the packet and apply.
As shown in the pictures.
So we applied it how it's shown, upper right, lower left.
Open packet and apply pad onto patient's bare skin.
Okay.
Apply pad as shown in the picture. Press pads firmly on skin.
Okay.
Do not touch the patient. Analyzing heart rhythm.
So now it's saying that it's going to analyze the heart
Do
rhythm.
not touch the patient. Analyzing
You
heart
have to
rhythm.
clear.
Shock advised.
And now it's saying to
Do
shock.
not touch the patient. Press the flashing shock button.
So when the button flashes, you shock them.
Shock delivered.
The
Begin
shock was
CPR.
delivered, and so it's saying to begin CPR. So you begin CPR. What we're looking for is for that the patient comes back to, has consciousness again, is breathing again, his vital signs are up, and we're waiting for the EMS to come, because whether or not he does come back to consciousness or he starts breathing again, he's going to the EMS.